Hello and welcome everyone to the Better Health Connect AI and Health Communication, a collaborative partnership webinar. Thank you all for attending. My name is Hannah and I'll be serving as moderator today. First, we would like to encourage everyone to please type their name, organization, role, and relationship with AI within the chat area. Please note there is a separate area for chat and another for Q&A. Q&A will be addressed at the end of the presentation. The agenda for today will begin with an introduction of our presenter, then move into the case study presentation, Q&A, and final notes at the end. So our presenter today is Dr. Ayo Olagoke, the director of Better Health Connect. Ayo Olagoke holds a PhD in public health from the University of Illinois at Chicago and completed a postdoctoral fellowship at the Health Communication Research Lab at Washington University in St. Louis. She later served as an assistant professor at the University of Nebraska-Omaha, where she taught courses on health literacy, social marketing, and health communication. Ayo is the founder of Better Health Connect, an organization dedicated to leveraging art and emerging technology to enhance the reach and effectiveness of health information. A Google certified AI prompt engineer with a certification in script writing from the New York Film Academy, she integrates storytelling and technology to create equitable messaging, including a notable project on COVID-19 vaccination research that earned her recognition as the top cited author in the British Journal of Health Psychology in 2021. With extensive experience leading health communication projects for both government and non-government organizations, Ayo is a speaker and consultant who advocates for the responsible use of AI in health communication.
Thank you so much for the introduction. Thanks everyone for joining us. I'd like to say there are 1,001 things you could be doing at this time, but thank you for prioritizing the time to be here. Whether you're curious about AI or you're excited or you're a skeptic, I want to promise you that you will leave this place with fresh insights and new perspective on possible ways we can start to leverage this as a tool to bring our communities together. I'll start by giving a brief definition of AI, which you probably have heard about. It's trained computer models that simulate human intelligence in performing tasks. From this definition, you could see that this is not the first time, or AI is not a new thing. It's been here since about 1950, right? But what we're seeing now is rapid development when it comes to generative AI. And generative AI is a branch of AI, artificial intelligence. Unlike the rule-based AI, which we've always had, Gen AI has the capacity to create new content, such as text, images, and more from large data set, right? It has the capacity to generate new text, new images, new videos, and all of that, which is a little bit scary because there's so much creativity that could be done where it could mimic the original, the actual human creativity. When I do this, I like to always acknowledge that different people, just like every innovation, there are categories when it comes to adopting innovation, and different people are in different categories. And I like to acknowledge that personally as a self-reflection for myself, drawing from the definition of innovation theory, we understand that there are people who are quick to adopt an innovation. There are people who take their time and have concerns about it. No matter where you are in the adoption spectrum, I think for you to be here, it's still a great thing to just know more and understand what is that aspect, what is that concern that I have that if addressed, I will be able to make some decisions. So today I'm going to talk briefly about AI applications in health communication before I talk about our case study. I would say that AI has been used extensively in different fields, much more in clinical medicine, and just a little bit more of empirical research has been done when it comes to health communication or even public health. We've seen a lot in clinical medicine, patient education, but still there are some aspects where we're beginning to use AI tools in health communication. An example would be informative research. Tools like Perplexity.ai has been used in analyzing data and conducting literature review, which is a big part of any campaign or any health communication program you want to do, right? You want to know what exists, what has others done, what works, what doesn't work. And this tool, which we'll talk a little bit more as we proceed, has been very, very useful. So these are some of the ways that we've used AI in health communication specifically. Also in message design, tools like copy.ai, ChatGPT, OpenArt AI, or Gemini has always been used in creating text, images, and all of that. In a particular study, like I said, there are quite scanty study, empirical or documented research-based study on this, but there is one on folic acid where they compared human-generated tweets with AI-generated text on this particular topic of folic acid. And the AI generated text perform better in terms of quality and clarity. Another way we've been seeing the use of AI is social media. So tools like Buffer would help you scan your content and tell you when it's best to post this, which of your content will do better, and suggest time or modifications you should make, hashtag to make your message go viral. Because as health communication professionals, the goal is not just to plan a very good program. We want to have the program, we want to design it, but much more importantly, we want to amplify the spread, the reach of that program. So there are tools that have been able to do that. In a recent study, on JAMA where they compared a chatbot with physician responses to patients' questions. So they scanned through social media and they sort of identified 4 or 5 top questions that patients are asking, and they asked the chatbot to provide a response. They also asked physicians to provide a response. They tested this and they found a high preference for the chatbot. One of the criticism that these type of studies have received is when because they try to compare human versus AI, which I think is not the best way to look at it. Instead of doing as an either or, like humans better or AI tools better, I see it more as AI human integration, more like a collaborative thing because there is no AI tool that works on its own. There's still this part where the human has to be involved. So it's not about the AI tool produce a better result. It's more of what are humans doing with AI, not what is AI doing, because it doesn't work on its own. So that's just one criticism I like to put out there. And in case you're wondering, how are people using this tool in actual sense? I'll be showing a case study from our most recent project called the Barbershop Vax Talk, where we used different AI tools to generate this 3D illustration on COVID-19 vaccination. And I'll be walking you through the steps that we went through in creating this. By the way, we created all of this in less than 30 minutes. So talk about speed, right? We use different AI tools, which we would look at for literature review, script writing, visual creation, and AI output evaluation. Just in case you haven't seen it, I'm just going to run through the few slides that we have from the illustration. It's basically about barbershop conversation, African American men discussing about the COVID vaccine, where the customer says, I think I want to get it. The barber is hesitant. The customer tried to provide a reason for why he decided to get the vaccine, and the customer is having a change of attitude. The barber asked questions which were answered, after which there was a level of persuasion and decided to ask for more information from the healthcare provider and decided to probably get a vaccine. So that's just like a rough summary of what it's about. And this all was built on the newly updated COVID-19 vaccination approved by the FDA for 2024-2025. We created all of this using AI, and I'm going to walk you through how we did this. And also we evaluated it, we tested it, and I'll show you some of the results from message testing. First, we did a literature review using an AI tool, Perplexity.ai. The goal of the literature review is to identify barrier beliefs to COVID-19 vaccination among this group of people. I'll say there are several tools you could use for your literature review, but some of the reasons we chose Perplexity is because number one, for every output they give to you, they will always give you citations. So they're one of the few tools that they'll give you references and citations for whatever output they generate. They are also trained in using academic research. So the input data for training that particular model is very rich in academic papers and literature reviews. So this is one of the reasons we decided to choose them. We introduced a very simple prompt. This is a standard prompt, and we'll talk about different types of prompt where we ask, what are the reasons why African American men um, may be hesitant from literature to receive the vaccine? As you can see, several reasons were stated here. So many reasons. So here's the prompt we gave. What are the reasons why African American men don't get a COVID vaccine? It's going to list several reasons, give us citations on, if you click any of those numbers, you can see the source. Of course, like every other tool, you still want to validate the source, like every other AI tool, just to be sure. Now we decided to pick one of the reasons, and we chose perception of risk as a barrier belief that we would focus this campaign on, low perceived risk or low perceived susceptibility. We chose this because there are some modifiable factors and there are non-modifiable factors. So we wanted an intrapersonal factor that is also modifiable, and we can use the tools that we create. Of course, there are several reasons, mistrust in healthcare institution and all of that. But those are kind of hard to change barriers, right? So we wanted to select an intrapersonal factor where we could use our campaign and test the outcome. Next, we've identified our barrier belief. Next is script writing. We decided to address this barrier belief using storytelling. Two major reasons why we chose storytelling. I'll say three. First, using the extended elaboration likelihood model. Storytelling has the ability for narrative transportation or narrative involvement or transportation. This is the ability to transport the audience into the story, which is a strong predictor of persuasion. Another factor why we decided to choose storytelling is character identification, which has been proven to be a strong variable for predicting change and persuasion. So when the audience is able to identify with the character in the message, they are more likely to be persuaded, which could lead to an uptake of the positive behavior we're trying to model. And the other reason is we don't want to present the fact in a forceful way. We want to present it in, like a relaxed entertainment method way. So the tool we decided to use is ChatGPT. And what we did here is to create an initial prompt. And I'll draw your attention to some of the key points in this prompt. This is what we call a chain of thought prompt. The initial one we use for the literature review is standard prompt. So we said create a conversation between two African-American men in a barber shop, barber and the customer, where the barber does not want to get the vaccine because he feels it's unnecessary. The customer tries to persuade him by explaining that he got the vaccine to protect his 4-year-old son with weak immune system and grandmother with a chronic health condition. Apply the 3-act structure to this conversation. Make sure each person has no more than 4 exchanges in total. Key things I want to highlight here. First, we're very clear about the character. There are 2, not 3, not 4, 2 African-American men in the barbershop, very clear about the location. Also, the reason for the hesitancy is because it feels it's unnecessary. We also highlighted the reasons we want you to give in making the case or the persuasion. 4-year-old son with weak immune system, grandmother with chronic health condition. We chose this because studies have shown that these are high risk group. And this is why when you're working with AI, which was why I said it's not more of the AI is doing this, it's more of what humans are doing with AI. The more detailed you get, the more descriptive you get, the more you're able to show or to tell, the better the outputs you're going to get from it. I also want you to see that we highlighted the 3-act structure to this conversation. This is talking about a script writing technique where it's a playbook from script writing where you have to have 3-act structure. So this is still the human part of me saying, this is what I want. I want to draw from this. I want to draw from empirical research on what you should use in your persuasion. I also want to draw from script writing and storytelling. So there's still so much of human part in this. And so it shouldn't be more than 4 exchanges in total. Now, this is the initial prompt that we used, we created. And the next thing is we went to OpenAI on their best tips for writing prompts. They have a list on some rules you should follow. So we copy the link from here, and then we're going to say refine this initial prompt using the tips from this particular website and give us a refined prompt. We are not even talking about the output now. We're saying refine my prompt using the link on best prompting tricks. And you're going to see what it's going to generate for us. So it takes all of that and then it generates a refined prompt, different from the initial thing that we imputed. We're not even asking for the script now. We are still refining the prompt and working on it. Here's our refined prompt. It added all the basic things that we said. We still have 2 people, we still have COVID vaccine, we still have these are the argument points we want you to put in the conversation. But then it added something really, really interesting, which says focus on their emotion and perspective to create a realistic and engaging dialogue. I didn't add this in my initial prompt, but then when it was refined using the tips from ChatGPT by itself, it was able to add that part to it. So we copied the refined prompt. Now we're ready to put it into a GPT. And it goes into action. Creates it using the 3-act structure, the setup, the conflict, the resolution, using the reasons that we provided. Now we have our script, took this and did a little bit of tweaking to it, and we're ready to proceed to the next stage. So we've identified a barrier belief, we've created a script using the key things that we wanted to see. Next is time to create our visuals. Like I said, we want to create a 3D illustration, right? So we know what we're addressing, we know this, we have the script, and now it's time to create the visuals. The tool we use for this is ChatGPT and DALL-E 3. DALL-E 3 is one of the largest LLMs when it comes to image generation. It's used by Microsoft, GPT, OpenArt AI, and some other platforms. So it's really good when it comes to creating image. Here's the prompt we entered for our image generation. Create a 3D illustration of an African-American barber cutting the hair of another one while they are conversing in the barber shop. Still, we're very clear about it has to be 3D illustration, not comic, not painting, not 2D. Very clear about it. The more specific you get, the better the output you get when you're creating this. And then we said, make the barber wear glasses, put no glasses for the customer. The customer should have faded hairstyle, full beards. The barber should have dreadlocks, no beard, make the illustration 16 by 9 dimension. And we did a little bit of directing, make it a wide shot. Now, this is very, very detailed, right? Especially when you're creating image with it. You want to get very descriptive. The more you get, now, one of the reasons we spend time on this is because of the character identification piece. We want to be able to create a character. If you write scripts, you know that you could spend about 3 pages just describing your character. So this is us doing a brief version of this and creating this character. So we put this prompt, GPT, and the magic starts. This was really faster than I thought though. Um, just within few seconds, we're able to generate at least the first draft of the image. And here is what we have. If you compare this side by side, the prompt that we gave, you can see dreadlock for the barber, you can see glasses, you can see the beards, you can see faded hairstyle. And why we're getting this detailed is because of the elements of character identification, which I'll be showing you what we found in our output evaluation of some of this. So you want to get very detailed. You want to be able to create your own character to your own taste, especially if you're working with storytelling. Even if you're not using storytelling, as long as you're using images or visuals, you want to get very descriptive. So here's the final image we generated. We have 6 different frames, and then this is what we tested. We included the dialogue from the script, and we tested this. So now it's time to test output and to evaluate it. It's very important to always test whatever output you get, because you want to make sure that while using AI, you're not widening the health disparity you should be addressing, right? You want to make sure there is no bias and there is fairness. The tool we use for this is ChatGPT, and this is not the only tool, but this is like the closest AI tool that we used to test the message output. Again, we created a prompt to say, I created a COVID-19 vaccine illustration. I want to test it for effectiveness, perceived quality, intention to share. So this is different from saying, test it for me or test my message. So, which is why I talk about more of AI collaboration. AI is a good collaborator, but it's a very poor supervisor. So if you just say, test something for me or create this for me, then you probably won't get the best out of it, or you get hallucination or very biased out. So very specific tests for effectiveness, specific quality, and intention to share. We picked on this quality drawing from the extended elaboration likelihood model, which says that these are key qualities you want to test for when you're using storytelling in your intervention. So you can see that element of the knowledge that I have from research, psychometry, bringing it also into this. Ask if they've seen any COVID vaccine information material, either physically in the last month. Then ask how they will rate this illustration compared to other materials they've seen in terms of clarity, quality, and appeal. Keep it under 10, none of that. So generated these 10 questions. Have questions on clarity, effectiveness, intention to share, what people like most, which is part of the prompt that were requested. This is so important because when you're thinking about psychometric measures and you're thinking of creating an evaluation, you want to be sure that there is an element of validity for your question. Is this question reliable? Is it valid? You want to look at all of those features. And this gives the opportunity, especially in your prompting, to create questions that are reliable. And you can also go ahead to test them using some psychometric tests as well. Now we have our questions, and we surveyed 100 African Americans and we asked them those questions. In all, we had 61% female. In terms of quality, 64% said it's excellent or good. 88% rated it for clarity. We collapsed some of these responses because of the small sample size. About 64% said it's better or much better than any other COVID-19 vaccination message they've received. This is really, really big. For us, we are not comparing this to human. So we're not saying human versus this, because there is a whole level of human involvement already in this, which is why we're just asking your perception about the message. In terms of effectiveness, 86% said it's effective, 63% talked about likelihood of sharing this message. We also asked, very importantly, what you like most about the message. 32% said visuals. So most people talk about the visuals, clarity of the message, simplicity, relatability, and overall design. 89% said it's relatable, and majority said it's persuasive. This is so important. And if you look at these outputs, you could draw from different health communication theories, theory of planned behavior. We talked about how intention is one of the proximal predictor of behavior change. And we have all those elements, even though we're using an AI tool. Just to highlight some of the key results again, in terms of excellence, 64% rated the quality as excellent or good, 89% relatability. And to see that all of this was done in 30 minutes, it's really, really something that is very laudable. We wanted to probe more into this relatability, and we did a bivariate analysis, which shows that among people that are 18 to 48 years old, 43% said this is relatable. However, among those who are 35 to 54 years old, 54% said this is relatable. This variable is very important because character identification is a big part of storytelling. So we know that if people consider it to be relatable, then the strength of the persuasion would be much more higher. So we wanted to dig deep into this, and we went to ask, we had a qualitative study where we asked, if we were to redo this, what would you suggest we change? For those who are 18 to 34 years old, they gave us reasons because we wanted to improve if we were to improve on the relatability, which is an important part um, when you're thinking about using AI. So make it longer. 18 to 34 years, make it longer, at least 2 pages. I think the information is spot on. Suggest where to get the vaccines. Make it 2 friends instead of a client with a service provider. This is a very good feedback. Maybe use fewer words, add more diversity. Very great feedback. We also asked for those 34 to 54 years who rated it high on relatability, and they also talked about add the side effects of the vaccine. Make the font bigger, include women. And these particular comments really, really stood out to me. It says, the message is conveyed in a concise, friendly, and unforceful manner. This is so important because when you're able to create a program, you have your goal in mind. And a lot of time we don't articulate the goal, but we do lots of things. So for you to find an audience who can articulate your goal without seeing it where you wrote it, I think that's really great. So friendly, conveyed in a concise, friendly, unforceful manner, which was why we chose storytelling, which was why we decided to write the script and present it this way. So I think that was really great. If we were to redo this again, we would take these comments, we would be able to use them to refine our outcome. So just a little bit about the strengths and the limitations of our study. Number one is the evaluation. We're able to evaluate the AI's outcome across different demographic groups. So we could identify disparities and also improve the fairness and equity in the model's outcome. This is so important. This is one of the biggest criticism and that AI has received, the fact that the outcome could be something that is biased towards a particular group. But with this evaluation, you could make changes when you're creating your programs with it. There is also another strength of timely image generation and that accurately reflects diversity, representation of the population we intend to serve. Before the advent of AI, when we need images for our campaigns, there are a couple of options, things we could do. We could decide to hire an illustrator. I mean, if you were to do this without AI, and then you would say, hey, create for me something, this, and then we give the description. Then when they create the draft, you make changes and you say, oh, change this, change that, change this. So that takes a whole lot of time. The other way you probably could have created your image is to just go online and look for existing images that are free from copyright, and you just choose something. But the downside of that is you may not find an image that is tailored towards what you really, 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 really want, that meets all the description, how you would exactly like it to be, which AI is now able to help with that. The other thing you could do is to purchase a copyrighted image online from, platforms like iStock or Pexel or Adobe Photos, and you can buy from there. But then even at that, you still may not find an existing image that meets all your specifications. So the strength of this is we are able to tweak the model to say, create exactly what I want, create two people wearing this, looking like this, in the way that I would want it to appear. Some limitation though, you would see that there is lack of consistency in the character across different visuals. If you look at the image to the right, um, the barber, for example, has different colors of clothes, right? Two different people. The model is still not trained to identify the uniqueness in each character and create exactly as it is. So far, we have lots of it hasn't been trained to identify that uniqueness. So if you enter the same prompt that I use, you'll probably get a different type of image because it doesn't really recognize the features for now. However, if you look at the lower image with the barber on dreadlocks, we are working on some tools now where we are able to create that some tricks around how you can maintain consistency in image. But it's still not so easy to do. This takes a little bit more time and effort, but it's kind of possible to create that consistency. Another limitation is the inclusion of motion, visuals, and videos. So right now, GPT is good with just images. It used to be text only, but now they have images. And there's limitation. You can't really create real motion videos, even though you can animate these images to an extent. And there are other software like Beyond, OpenArt that they have videos, you can create videos and use it. The downside of those is they have fixed characters. There's limitation to how you can change some of the character, the elements. So they have existing um characters. So you just have to use them that way for the videos. You can't really tailor make the character or change so many things. Many things just are static the way they are. But it's still a good one though. And those are limitations. In terms of future work, some of our goal is to build a custom health communication chat GPT to minimize AI hallucination. So we want to be able to build a custom GPT. And some of the best practices around creating your own custom GPT, which we already started working on, is you want to make sure you have at least 100, which is best practice. You have at least 100 samples or training data that you want to feed um, your custom GPT with. So if you're an organization where, for example, anything you do routinely and you've been doing for a long time, maybe you always have press releases, you always have specific, mental health month, and you always create content every year for some of these things. You want to make sure that um, you put all of those together and you can use it, train your model to build your own internal GPT. It's going to make your work so easy. Why this is important is you don't want success to just happen. You want to be able to automate success. If you create something and it works, you want an AI tool that could help you replicate that success over and over again. So this is one of the benefits of creating your own custom GPT. It also minimizes the bias output that you generate. We also want to use AI-powered messages, create interventions using AI for other topics. This is focused on COVID-19, but we want to use it for cancer prevention. And we have some in the works on HPV, uh, cancer prevention. We want to use it on other health topics and see if the outcome and the output would also be effective. We also want to explore other AI-generated health messaging models like podcasting. If you are on a newsletter, we'll be sharing just quick videos on some of these tools and what we're learning, and probably some that you could also use in your work as well. But we want to explore much more of this. Finally, research, research, research. There's still so much that has to be done in the area of that has to be done in the area of research when it comes to using AI. For example, if I input the same prompt into multiple AI tools like Gemini, ChatGPT, Perplexity, and I use the same prompt and I get different outputs, is there, like there should be research on which of them will be more persuasive. Is there one of these tools that is more persuasive for a particular health topic? Should we go to Gemini if we're doing cancer research? Should this be more? Like there should be research on this. There are still so many unanswered questions that we can do so much research on. So those are some of the future work that we're looking at. And we'd also like to work with you, your projects, your organization, some of the things that we do, and feel free to contact us. Some of the things that we do, we have AI training for teams and organizations to help create personalized campaigns. So we train organizations on how you can ethically use AI to create your own campaign, depending on regardless of the topic you're doing. And you can begin to automate this success. You can begin to document the things that work and build your own custom GPT and create a document on this. The other thing we do is we also provide hands-on practice sessions at conferences and schools for health communication professionals, public health professionals who want to demonstrate and show them what you can do. So these practice sessions are usually very helpful. And one of the reasons we do this, I'm going to show you, is that the more comfortable people are when it comes to using AI, the more we have people using it. Just like the definition of innovation theory talks about triability and observability. If people can observe how it's done and they feel more comfortable using it. So for example, if the only color I have on my platelet is red, the only color I can generate is red. But the moment I have blue, I can have blue, I can have red, I can also have red plus blue. The bottom line is the more people we can get interacting with these models, the more people we can get using these tools, the better the output is going to be. For example, I am bringing the storytelling piece with public health communication with the theory of change. This has helped improve the model. When you bring your own maybe engineering background with your public health background and your experience in public service and communication, and you also bring it into it, you're also improving the tool. So we do these practice sessions to make people feel comfortable, easy to do, easy to practice, and they can try it on. And the more they feel comfortable, the better, the more they're able to use it. We have more representation, we minimize the biases, and we reduce the unfairness around it. So that's something else we do. We have a conference tomorrow at we'll be presenting at Washington University on AI plus health. So we're happy to work with you on conferences or practice sessions with groups and teams, also in building that custom GPT model that is tailored for your internal organization use. One of the things that is very, very low right now is when it comes to AI, people are taking content from everywhere and they're building stuff. And the amazing thing is that people who actually create this, because the copyright laws is still kind of fluid when it comes to reusing publicly available tools. So I think now is the best time, because the future, what's going to happen in the future is, or one of the things I foresee is that people could go to a particular organization website, let's say the CDC, and go to their health communication resource and harvest all the tools they have there and use it to build a custom GPT and monetize it. And then there is limited access to something that should be free. But right now, organizations can start to train their teams on how to use their resources. The resources they have, they've developed over the years, they've worked on how to create their own custom model for internal use and even make it available if they choose to. So thank you so much for listening and for paying attention to this. I'm going to hand over now to Anna for questions.
All right, so we had a couple questions from Tracy. She stated, I noticed the characters in each frame were similar, but not exactly the same. Is this because it isn't possible to have DALL-E create the exact same character for different images?
Oh, yes, that's true. That's still one of the limitations of the model, which I think I mentioned here. It still find it very hard to create that um, consistent character. So right now it's going to give you differentiates. But like I also mentioned, we're learning specific ways you can still work with it. and still ensure you create consistency. It takes time, but it's still better. So there are some ways around it where you can still create consistency. But as at when we had this project, you couldn't really do that, and it only has different um character. I hope that answers.
Tracy also asked, she was curious about the funding for this project. Was the funding to try AI or was it to create a campaign on the topic and you used AI to create it?
That's a very great question. So for our organization, this was one of the projects that we created in-house. And the goal was to create it from start to finish using AI tools. We also wanted to test, evaluate the output and see what the reception would look like. So this is very much based on our organization project. And hopefully we hope you're able to learn some things from it that you could also use for your own um, program in the future. Thank you.
Okay, I have another question from Deb in the chat. She asked, which of these AI tools utilized are free for educators and researchers and or the public?
That's a very great question. Um, I'm gonna go back to where I have all the tools. So Perplexity has a free version. Some of them, I think they all have free versions that you could use. Some you could try them for 7 days. Some you could use it with limited um, features. For example, Perplexity, there is a part of it that you could use for free, but then the paid version can do much more things. ChatGPT, you have the free version, but the ChatGPT that has the capability for visualization and this image, you really need to use the paid version for that. So, but the ordinary ChatGPT, I mean, you can use that for free just with limited capabilities. So I would say that there is still a whole lot you can do with the free version till you feel comfortable and you want to try the paid version. But yeah.
Okay, Deb also asked, is there a way to utilize the characters you've created in this campaign so that you can keep some characters consistent? For example, is there a way to show the client and create more scenarios such as later interacting with friends or family or going to get the vaccine?
Absolutely, you can do that. It all depends on how you create your prompt. Using the chain of thought prompt, you can definitely do that. And those are some of the things that I would be happy to um, walk you through and show on how we could create that. But yes, you can create it to do anything. You can create it to with family and friends, with an audience. You can do that.
Okay, another question is, did you recruit people to evaluate the barbershop message?
Yes, we did. We had 100 African Americans who did this. We used the crowdsourcing platform that is mainly for researchers, where we had 100 people who volunteered. I mean, in their database, they have about maybe 25 million people or so. So it was easy for us to get 100. We had to specify, and they have this representative sample across the US. So it was easy for us to recruit 100 participants to test.
Okay, another question is, what is the cost implications of engaging your organization for personalized training?
Oh, that's a great one. I think, Anna, if you could just share an email so we could talk more about that and we could talk about specifics and tailor make the training to your organization needs. We'll definitely be happy to. I'll also share the contact information here. Yeah, we'll definitely be happy to talk further on that. Thank you.
Are there any other questions for anybody they'd like to put in the, oh, here's one. If you were to incorporate some of the feedback, such as side effects of the vaccine, how would you incorporate evidence into your prompt?
That's very great. I love that. If we are to do this again and we want to introduce that, if we're still going with the storytelling, we could do it in two ways. So we could have like end of screen, just like when you watch ads and they tell you everything about the medication, and then at the end they tell you this, the science and all. So we could do it that way where we create an end of screen, but we could also incorporate it into the conversation, which I think will be better because it's coming from um, you know, something that someone raised, a concern that someone has. So introducing this and saying, hey, but I'm worried about the side effect or whatever into the dialogue and then using it as a story. We'll just have to go back to our prompt for creating the script and then we'll say, make sure this is one of the concerns that this person raised. Address it by saying this. So we want to check empirical research to see how best to address this, which is what the human part of using AI comes. So we refine our prompt and say, hey, make sure this person raises this concern. Make sure you use this as a response to this. And that way we're able to create something that is still evidence-based.
I got a couple questions about if the recording would be available. So I just want to let everybody know that the recording, along with a survey, will be emailed to all participants. Is there any more questions that anybody would like to ask?
Okay, I think that's all the questions that we have. Please feel free to um, send us questions via emails if you think of any. And thank you for joining. Anna, you have something to say about the survey?
Yes, there'll be a survey emailed to all participants to complete, along with the recording of today's presentation.
Thank you for joining us. Enjoy the rest of your day. Looking forward to moving forward with this conversation with you. Bye.